Mr. President.
The Senator from New Jersey.
Mr. President, first, I have 6 unanimous consent requests for committees to meet during today's session of the Senate. They have the approval of the majority and minority leaders, and I ask unanimous consent that these requests be agreed to and that these requests be printed in the record.
Without objection.
Mr. President, today this Congress is facing a fundamental test of our values, whether to reauthorize the state children's health insurance program and expand it to cover millions of children who would otherwise be left uninsured. And we must ask ourselves, is this good for our nation's children? And the answer is clearly yes. Now, I say this as a father. There's nothing more important to parents than the health of their children, and there's nothing more important to helping them grow up to achieve their potential and contribute all they can to our society. It's no secret what a major financial burden health care can be. We're reminded of the costs every time we go to the doctor or fill a prescription at the pharmacy. There are parents who work every day in some of the toughest jobs in our country, but their jobs don't offer health insurance and their paychecks don't cover the cost of private coverage. They're not the only ones whose health is at serious risk because of this lack of insurance. It's also a major risk for children. Parents stay up at night worrying about whether the hard cough they hear coming from their daughter's room means she's got asthma, hoping that their pain in their son's stomach doesn't mean he's going to need surgery, wondering how they're going to pay for a routine checkup, and just praying that everyone stays healthy until they can afford to get the health care they need. Here's one story. A boy named Jonathan took a trip to the New Jersey shore with his family. His head started to throb on the ride from his home in New Hampshire. And finally, the pain became unbearable. I want to read what Jonathan wrote about his experience. He wrote, quote, "The pain was so bad, I had to crawl on the ground. My mom drove me to the medical center. I remember my mom calling my dad and asking the question, do we still have medical insurance? I remember being really scared. The doctor explained that I had an arachnoid cyst about the size of an ice cube growing on the left side of my brain, and my mother started to cry. There was another problem. Our insurance coverage had ended. Going to the hospital and having all of the CAT scans and MRI testing was super expensive. Suddenly, insurance was a huge issue. Friends told us about a program called New Hampshire Healthy Kids. My parents had to act quickly and registered my brothers and me for the program. The people at NHHK were really helpful, and I was able to get the medical attention I needed. Thank goodness Jonathan was okay. But it's stories like this are why the federal government and the states teamed up to create the state's children's health insurance program. It's been a great success across the country, covering over almost 7 million American children. And in New Jersey, it covers almost 130,000 of those American children. This year, Congress has an opportunity to make the children's health even more inclusive, to pass a bill that will continue to provide health care to the almost 7 million children already enrolled and expand the program to include 4 million children across America. And that includes another 100,000 children in my home state of New Jersey. As we're considering whether to reauthorize and expand children's health, we all have to ask ourselves 2 questions. 1, what would we want Jonathan's story to have turned out? Would we have wanted Jonathan's story to have turned out differently? Absolutely not. And 2, are we going to sit back as millions of other stories like Jonathan's don't end up as happily? The decisions we make today have very clear implications for hard-working families around this country. The difference here between no and yes can mean for millions of children the difference between helplessness, suffering, and pain versus opportunity, health, and a better quality of life. That's how high the stakes are. Now, some in this chamber may question whether we can afford more health care for our children. Let's look at the facts. First of all, this legislation won't cost us a dime because it's completely paid for. Second, making sure kids can get regular checkups and focus on preventive care has the potential to reduce emergency room visits and save costs down the line. We also need to be very clear. Public health insurance does not mean free health insurance. Many families across America and in New Jersey are responsible for co-pays and have to pay a premium every month. They are part of supporting their children's health care coverage. But all that aside, let's look at the bigger budgetary picture, at where our priorities have been for the last several years. The war in Iraq has currently cost us $5,000 every second. With what's spent on the war in Iraq in 40 days, we could insure over 10 million children in America for 1 year. In fact, with the amount that's been spent on the war, we could provide 2 years of health care coverage for all of the 47 million Americans who don't have health insurance, who play Russian roulette every day with their lives and their wallets. And even after providing all of that health care for every American who doesn't have it, we'd still have $30 billion left over. If we're willing to look at our priorities and choose our children, as we often say, I've heard many of my colleagues speak here on the floor about how our children are our most precious resource. They are, but they are also our most vulnerable resource. America's health care crisis is something we absolutely can do within the reasonable constraints of our budget. Now, some of our colleagues have also objected, I've heard it here on the floor, to how states like New Jersey are treated under this legislation. They object to my home state's ability to cover children whose parents' salary. Well, I want to give a rounded estimate of the monthly costs facing a family living at 250% of the poverty level, or about $4,594 per month in one of our counties in Middlesex, New Jersey. When you look at that monthly income, and then you look at the cost for housing, for food, for child care so you can go to work, for transportation, for the taxes that are paid there, and then what it costs for health insurance, the reality is that you have a set of circumstances where that family has a monthly deficit, a debt of $898, which means they don't have the wherewithal to do all of this. And these are the basics. These are the basics. These are no frills here. So they find themselves in debt. And on top of that, comparable private health insurance in my home state can almost cost about $1,800 a month. So what does a family have left at the end of the month? The answer is a staggering load of debt. If they're making 250% of the federal poverty level, they're going to be in debt almost $900. It's the same in other parts of the state as well. For example, if they're living at that income level in Trenton, New Jersey, the state's capital, they're going to be in debt about $856 every single month to do the basics. To have a place to call home, to put food on the table, to have child care, to go to work, transportation, to be able to achieve that, to pay their taxes, and then to have health insurance. They don't have enough money to make ends meet. The federal poverty level doesn't reflect the difference in cost of living between states. For example, if you're a family making 250% of the federal poverty level in Phoenix, Arizona, after all is said and done, under the same set of criteria, housing, food, child care, transportation, and taxes, and health insurance, you have a monthly surplus, a surplus of about $1,347 left over at the end of the month because the cost of living is lower. Now, there's a huge difference in the family's reality with the surplus and being able to have all of these essentials versus having a debt in the two examples I showed before. Let me give you another example. In Salt Lake City, Utah, the same set of circumstances, housing, food, child care, transportation, taxes, health insurance, you have a $1,469 surplus. So you have disposable income to make other important choices for your family. Same set of circumstances in terms of the federal poverty level. The reality is that we face a much higher cost of living, and the consequences are real to New Jersey families. Now, let's not just compare. Let's just compare state by state. I understand that 350% of the federal poverty level sounds somewhat high if you don't see the numbers, but what it takes to meet that amount in New Jersey, it takes a much less amount in all of these states, from Kentucky and Arizona and Oklahoma and Georgia and Tennessee and Utah, Missouri and North Carolina, much less to meet the same level of the federal poverty level. So the bottom line is we simply have a higher cost of living, and one size doesn't fit all. Now, I wish that our citizens could get the same quality of life in terms of the essentials for much less money, but that is not the reality. So it makes perfect sense for different states to cover children to different levels of income in order to accomplish the same goal, which is ensuring that children at the end of the day are covered. Even former President Bush understood that when he approved New Jersey's waiver, as he did for a long time. And even then, I'd like to point out the number of New Jersey children who fall into that category is just about 3,300 children, a tiny fraction of those enrolled nationally. So only about 2.5% of our children are covered under this level of the federal poverty level. And finally, Mr. President, the last time legislation to expand children's health came up, hundreds of thousands of children were left out. Children who are legal, underline, legal, emphasis, legal, permanent residents of the United States, who follow our laws every step of the way, whose parents work hard and pay taxes. Some of them are actually in the service of their country. These children are eventually eligible for Medicaid or SCHIP, but the law says we have to bar them for coverage for 5 years first. To a young child, 5 years is a lifetime. Here's what it means to bar legal permanent resident children and pregnant mothers from affordable public health for that long. As it stands, a girl with asthma has to go through 5 years of attacks before she can get an inhaler. A boy whose vision gets so blurry he can't see the chalkboard in 4th grade has to wait into high school before he gets glasses. A pregnant woman who urgently needs prenatal care can't get it until her child would be ready for kindergarten. Now, I haven't met anyone who isn't outraged when they hear that kids with cancer would have to wait 5 years for chemotherapy. Now, most people can't believe that's the law, and it shouldn't be. Children shouldn't have to wait a single day to get the care they need to save and improve their lives. Good health care is essential for them to be able to fully realize their God-given potential. And children, whether they be in a classroom or on a playground, are contagious. And so whether it's a legal immigrant child or a U.S.-born citizen, the bottom line, they're playing in that playground together, they're sitting in the classroom together. One has health care, the other one doesn't because we have an arbitrary bar. It's easy to get, some cold disease contagious. So there's a public health interest here for all of us. So we have an opportunity to do the right thing and make a major step towards ensuring that no child in America goes to bed at night without health care in the greatest nation on the earth. This legislation would bring 500,000 kids nationwide into these state health insurance programs in this category. So let me conclude by saying for all of us, this is a matter of values. Do we value our children, and do our actions match our values? For those who value life, who have spoken very eloquently in this chamber about its sanctity, and for those who value family, who consider it the bedrock of our lives and of our country, now is the time to show the depth of that belief. Because if children's health isn't about protecting life, I don't know what is. If this bill isn't pro-family, I don't know what is. Now's the time to give new security to millions of young lives, to help America's children achieve their God-given potential, and to replace fear in millions of minds with hope for a better day. That's the opportunity before the Senate, and that's the one I hope that we will adopt at the end of this process. Mr. Chairman, with that, I yield the floor.